So I have verified the healthcare provider's orders, which is, and I've done this by doing the 6 rates of medication. So the patient is Justin Doan. The medication and dose is regular insulin, 4 units, and NPH 8 units, which is going to be a total of 12 units. The route is subcutaneous injection, and the time is every morning before breakfast. So I'm going to introduce myself. Hi, my name is Brittany. I'm going to be your nurse today. Can I have your first and last name?
Justin Doan.
And what's your date of birth?
11/16/1999.
Okay, do you have any allergies?
No.
Okay, so I have checked your blood glucose, and I know that your next meal is going to be here in about 20 to 30 minutes. So I'm just here to, inject your insulin. You're going to have a little bit of burning when I first inject it, and you might have some hunger, some shakiness, and some sweating. But please let us know if you have any adverse reactions, which is like anaphylactic symptoms. Do you have any questions?
No.
Okay, so I'm just going to do hand hygiene, and I'm going to put on some gloves. And I have all of my supplies already ready here at the bedside. Okay, so I'm going to check that the insulins are the correct ones. So this is the regular dose against the MAR, and I've checked the expiration date, which is 7/24, and the NPH expiration date, which is also 7/24. I have let them come to room temperature, and I've also inspected for quality and any changes that might affect the potency. So I'm just going to now verify the healthcare provider's orders again, and that's going to be 4 units of regular and 8 units of NPH, so it's going to be 12 units total. And I've had another nurse verify that this is the correct dosage. So now I'm going to roll each of them between my hands. Okay, you can scoot back actually if you want. And then, so now I'm going to take off the caps, and I'm going to take an alcohol swab to the top portion of each one. Okay, so those are both clean. So now I'm going to take the plunger, and with the cap still on, I'm going to pull back 12 units of air, which is the total dose. Okay, so now that it has 12 units, I'm going to take the intermediate one, which is the NPH, and I'm going to inject that dose of air. So I'm going to inject 8 units of air into the NPH, and then I'll inject 4 into the regular. So I have the needle, and I'm making sure the needle is not going to touch the solution. And so I'm going to inject 4. So now the plunger is sitting at 8. I'm going to take that out of the NPH. Oh no, sorry. The plunger needs to be sitting at 4. Okay, so it's now at 4. And now I'm going to put it into the regular, and I'm going to put the remaining dose of air, so 4 doses, 4 units, and now I'm going to invert it and take out 4 units. Okay. Now making sure there's no air bubbles by tapping it, and there isn't any. So now I'm going to verify the dose of the regular, which is 4, and there is 4 in the vial, and I verified it against the MAR, and I'm supposed to have 12 after I do the NPH. So now I'm going to go into the NPH. I'm making sure I don't inject any of the insulin into this one, and I'm going to pull out 8, so it'll be 12 total. making sure I don't need to push any in. So now it's at 12, and I'm gonna tap it, make sure there's no bubbles, and I'm gonna check it against the MAR again. So the total should be 12, and it is at 12. And now I'm going to do the scoop method to recap it. And if I wasn't at the patient's bedside, I would now label this with the name and the dose before injecting it.